Welcome back, students, to the continuation of anti-muscarinic agents. In this video, we'll discuss about the adverse effects and toxicities, drug interactions, and contraindications of atropine. So, coming to the adverse effects of atropine, it is very easy to remember. They are just extension of pharmacological action. So, if you know the pharmacological action of atropine, they are just extension of pharmacological action. So, remember on the glands, the exocrine glands, atropine can reduce the secretions. So, there will be dryness of mouth and difficulty in swallowing. On the eye, it can produce mydriasis, cyclopegia, photophobia, etc. Right? So there will be blurred vision, photophobia, and precipitation of glaucoma. Constipation will be seen. There will be decreased sweating, and because of that, there will be hyperpyrexia, increased body temperature. It can lead to difficulty in maturation and urinary retention because increased tone of the sphincter of the bladder, trigone of the bladder is seen. It can lead to allergic reactions like rashes and CNS symptoms like excitement, restlessness, psychotic behavior, ataxia, delirium, and large dose can lead to vasomotor collapse. Coming to atropine toxicity or poisoning. So atropine poisoning could be accidental by accidental ingestion of the seeds or leaves of Datura stramonium and Atropa belladonna. Okay, so atropine and scopolamine, they are alkaloids derived from these plants. So accidental ingestion of leaves or berries can lead to atropine poisoning, or it could be due to suicidal intentions. So atropine usually has a high margin of safety, and toxicity can occur in overdosage in adults above 80 milligram orally, and infants and young children, they are usually very susceptible to toxicity. So even with 10 milligram orally, it can produce poisoning. And other drugs with anticholinergic action like tricyclic antidepressants, antipsychotics, phenothiazines, antihistamines like promethazine and diphenhydramine, they can also produce uh, antimuscarinic toxicities or atropine intoxication symptoms. Now, it's easy to remember the symptoms of poisoning. So you know the adverse effects, symptoms of poisoning. So in overdosage, they can lead to these symptoms. Dry as a bone because there will be dry skin because of drying up of secretions. Red as a beet because of hyperpyrexia and flushing of skin. Blind as a bat because of the effect of atropine on the eye, like blurring of vision, photophobia, and mad as a hen because of the CNS symptoms like confusion, delirium, restlessness, and hallucinations. So dry as a bone, red as a beet, blind as a bat, and mad as a hen. And these symptoms will be followed by coma, cardiovascular collapse, and respiratory paralysis. And scopolamine or hyoscine is seen to be more toxic than atropine. Now coming to the management or treatment of atropine poisoning or toxicity. So supportive measures, the patient can be kept in a dark room to alleviate photophobia. Gastric lavage can be attempted if the drug is taken by oral route to prevent the further absorption. Gastric lavage with tannic acid can be done. Catheterization for urinary retention, oxygen and artificial respiration can be attempted, and ice sponging to reduce fever may be required. So the specific treatment for atropine poisoning is physostigmine or neostigmine. Physostigmine can be preferred if CNS symptoms are also seen. So physostigmine, the dose of 1 to 4 milligram intravenous or subcutaneous, or neostigmine can be used. So as all of you know, physostigmine and neostigmine are anticholinesterase drugs. So they block or inhibit the cholinesterase enzyme and further increasing the concentration of acetylcholine. That is the main drug or treatment for atropine poisoning. So atropine is an anti-muscarinic drug. They usually block the muscarinic receptors. So you can try to increase the concentration of acetylcholine using anticholinesterase. And diazepam can be used in small doses to prevent convulsions and delirium. Next, coming to the contraindications of atropine. So, In narrow iridocorneal angle, atropine can precipitate glaucoma. So in patients with narrow iridocorneal angle, should not use atropine. And in elderly males, especially with prostatic hypertrophy, they can lead to urinary retention. In chronic lung conditions, they can reduce secretions and produce drying, and in congestive heart failure with tachycardia. So these are the conditions where you should not use atropine and antimuscarinic drugs. Now coming to the drug interactions, absorption of most drugs are slowed. And in Parkinsonism, the dose of levodopa needs to be increased. So why the absorption of most of the drugs is slowed? Because gastric emptying is delayed. Whereas digoxin and tetracycline absorption is increased, tricyclic antidepressants, phenothiazine antipsychotics, and antihistamines, as I've already mentioned, they have anticholinergic action. So if you give those drugs with atropine or other antimuscarinic drugs, additive side effects can occur. And monoamine oxidase inhibitor, MAO inhibitors, can interfere with the metabolism of anticholinergic, antiparkinson drugs and can lead to delirium. So with that, we come to the end of antimuscarinic drug. Thank you for listening.